Hi everyone, welcome to week 9 of your Pharmacology 1 course. This week we're going to be covering chapter 11, which is cardiovascular drugs. But before we get into looking at this chapter, I do want to give you a few reminders. This is week 9, so next week is our final week. The final week always ends on Thursday. So that means that you'll need to make sure you have all of your work in by next Thursday. All of your assignments are still open. All of your quizzes are still open. The only thing that you cannot still complete is your discussion posts. So if you haven't completed an assignment, if you haven't completed a quiz, or you haven't finished a pronunciation test, you can still complete all of those. Make sure on the pronunciation test that you are making a recording on the link, or you're calling my cell phone and leaving your list there. If you have any problems or questions about anything that you're missing, please let me know before the end of next week because we want to make sure that we get everybody completed on time. So this week, as I said, we are covering chapter 11, which is all about the cardiovascular drugs. So there's several different categories of drugs that fall into the cardiovascular drug category. Those include the beta blockers, the calcium channel blockers, ACE inhibitors. They all work just a little bit different. So that's why we're looking at all of them in categories like that, because each category works in the body just a little bit different. So we're going to be looking at all of those. We're going to also look at what we can use propranolol for. We're going to look at ways that digitalis toxicity can be treated. We're going to describe the therapeutic effect of nitrate drugs. We're going to look at how epinephrine is used to treat cardiac arrest. Then we're going to also look at generic and trade names of a lot of those cardiovascular drugs and making sure that we know which category they belong to and what disease they actually treat. So the first thing we're going to look at is hypertension. Hypertension is when we have an increase in either the systolic or the diastolic blood pressure. So when we think of hypertension, what we're thinking of is high blood pressure. And so that high blood pressure can be characterized by both the bottom number, the top number, or both. And there's a lot of causes for high blood pressure. Some of them are listed here. And so once we identify that somebody has high blood pressure, then we're going to look at some of those different drugs to treat them. Now, blood pressure is considered normal if it's lower than 120/80. So the idea is we want to keep those numbers within specific ranges. So if we've got the top number between 120 and 139, or if we have the bottom number between 80 and 89, that's considered pre-hypertension. So that means that's someone who is at danger for having high blood pressure. So these are just, some of the reasons why we want to start treating hypertension because it's going to cause damage to your heart, your blood vessels, kidneys, other organs, things like that. Some of the drugs that we typically use to treat hypertension, a lot of times we start with the diuretic type of medications. And what those do is they help you excrete water from your urine, but you also lose sodium too. So you're losing both sodium and water. And that basically is lowering the blood volume, so you're not pushing as much through your veins and arteries, which then lowers your blood pressure. There are some downsides to some of the diuretics. Some of the diuretics also deplete your potassium level, which can cause problems with your cardiac function. So there's pros and cons for everything. The beta blocker category of drugs decreases the heart rate of dilate the blood pressure. So in the blood vessels. So what that means is they are going to change how the blood vessels dilate, okay, open and close. And so some of the drugs that we use in that category include Inderal, which is propranolol. You saw that listed earlier. There's a lot of uses for propranolol. So they basically help to dilate those blood vessels, open them up further, and decrease your heart rate. So they do have a multifunction. Okay. This is just an example of a prescription bottle of propranolol. So you can see that, you know, it says right on there that one of the things it's used for is for hypertension. You're going to also look at some of the other categories of drugs include, I'm just kind of popping through some of these real quick. Oh, here's a few that you want to make sure you know. Tenormin is a real common one, atenolol. Low pressure is another common one, metoprolol. Notice the ending. All of these end in OLOL. That's how you know that you're dealing with the beta blocker category of drugs. So when you look at those generic names, make sure you're looking for some of those things that they have in common. That will help you learn those. Another category that you're going to see is the calcium channel blockers. What they do is they actually block the movement of calcium ions. So that is also used to help with hypertension, to lower the blood pressure. This is some of those in that category. Notice the endings on a lot of these, the IPINE. Okay, so that's how you know that that's the category you're looking at. This is just an example of the cardizem drugs. These are calcium channel blockers. That's just what they would look like in real life. Then we have the ACE inhibitors. The ACE inhibitors are angiotensin converting enzyme drugs. So again, we're dealing with an enzyme within the cardiovascular system that we're targeting in order to help lower blood pressure. Notice that these all end in pril. Okay, so captopril, enalapril, those kinds of things. Here's an example of quinapril. This is Acupril, the brand. Let's see. Angiotensin 2 receptor blockers. That is another category of drugs, and these all end in the sartans. Okay, so anything that ends with sartan, valsartan is a real common one. The Diovan. Let's see. There's some other categories of drugs that you're going to be seeing that kind of have a combination effect. They combine more than one type. So we have a diuretic along with some of these other things. So you'll see some of those combination drugs. These are just a few of them. Diovan HCT. So you have that Diovan, but then you add in the hydrochlorothiazide, which is a diuretic. Notice that hydrochlorothiazide is added to several of these combination drugs. So as you're going through the material this week, if you have any problems or questions, please make sure you reach out to me and let me know. Again, I just basically touched on the hypertension, but there's a lot of other things in this chapter. We talk about hyperlipidemia, which has to do with the lipids or the cholesterol. You know, there's just a lot of other topics, congestive heart failure, you know, anything and everything that has to do with the heart, and the cardiovascular system is covered in this chapter. So there's tons and tons of stuff. So if you have any problems or questions as you're going through it, please make sure you reach out to me and let me know, and have a great week.